This isn't a Harriman High School problem. This is a people problem.
We have to inform our community, our classmates, our teachers, our siblings, our families. We have to talk about it.
While it takes an entire village to raise a child, we believe it takes an entire community to save one.
There's few people that aren't impacted by this.
Everyone needs to know that they're loved for who they are.
Suicide is nobody's fault, and it's everybody's problem.
There's no time to let up. We have to continue to make this a focus.
There are multiple factors that lead to suicide, so there needs to be multiple solutions. We all want young people to be healthy and happy, and so I know that we can find common ground there.
Thank you for staying with us for this special Healthy Mind Matters report, life-saving legislation.
Over the last year, we've made progress, but Utah still has the 5th highest suicide rate in the country. It's a devastating distinction, and it will take our entire community to stop the trend. It doesn't matter who you are, where you live, your race, religion, or sexual orientation. There are few of us who haven't been impacted. More Utah adults have thought about or attempted suicide here in Utah than anywhere else in the country. The number of children making suicide plans or attempting suicide has also been on the rise. And experts estimate more than 100,000 Utah kids are in need of mental health services, but fewer than 20% are getting it. State leaders recognize the need for action, and with the help of a suicide prevention task force, identified areas for improvement. They've already made strides towards stopping suicide, but there's always more to do.
By the end of the Utah legislative session last night, 7 of the top 10 suicide prevention bills passed.
For me, it feels like Christmas because these are gifts for, the entire state of Utah.
Representative Steve Elison of Sandy is calling this a landmark moment for the state.
This session I submit is exponential compared to last session in terms of how much more these bills are going to be able to do.
House Bill 373 passed, putting $26 million towards more mental health therapists in public schools. He says it's enough for at least one new counselor, psychologist, or social worker in every school.
Give those children access to professionals that can help them hopefully deal with the issues that they're facing.
House Bill 17 also passed. It expands the free state gun lock program.
Regardless of maybe how you feel about firearms, everybody can agree on the culture of safety.
Elison says 87% of teens who die by firearm suicide use family-owned guns.
Really, the number one thing parents can do to help protect their child or another member of their family is to make sure that their firearm is safely secured.
A longtime advocate for suicide prevention measures, Elison saw how long people had to wait to see a mental health counselor.
And then they'll say, find a child psychiatrist, and sometimes it's a good luck getting into one.
House Bill 393 is one solution, allowing primary care physicians to consult psychiatrists about how to treat a patient through telehealth instead of referring them to someone else.
And then that primary care doctor can feel more confident in what they're recommending for their patient.
He hopes House Bill 174 will also help, funding 4 new psychiatric resident slots at the University of Utah.
And most of those doctors end up staying in Utah.
Senate Bill 38 passed, allowing doctors to look into a patient's mental health history before determining appropriate care. Senate Bill 39 will provide assisted outpatient treatment for people in crisis. And Senate Bill 106 allows schools to bill Medicaid for in-school mental health services.
Being a teenager is hard enough, and if we can provide extra help to kids who need it, I think we'll be able to cut down on the youth suicide rate.
Senator Lincoln Fillmore, whose district includes the city of Harriman, said he was thrilled over the progress made this year.
I really wanted to make sure that we're providing the services that people with severe mental illness need so that they're not a danger to themselves or others.
While many are pleased with what passed, others felt like they left the Capitol empty-handed.
Coming up next, the bills that failed this session and the number one thing both sides believe we need to focus on going forward.
It's people of good faith, without any agenda, saying what's the good policy we need to have here in the state of Utah. I am going to get involved now, and my commitment is we're going to find the solution here.
Welcome back. A lot of good things got the approval from legislators this session, but not everything made it through.
That doesn't mean the fight for those solutions, though, are over.
Now we're going to double down in a way we've never done before.
Representative Ellison had hoped to create a task force to study and compile data on opioid overdoses and suicides in Utah with House Bill 58. It failed. Also off the table for now, a bill that would have allowed family members or law enforcement to ask a court to confiscate firearms from someone demonstrating dangerous behavior. And House Bill 399, a bill that brought intense emotions, saw the session end without a passing vote. This bill would have banned conversion therapy on LGBTQ youth in Utah.
Conversion therapy is fraudulent, it's dangerous. We know from the data that when children are subjected to conversion therapy, the rates of depression double and attempts at suicide triple.
Proposed changes sparked a sit-in outside the governor's office, and its failure led to frustration.
Representative Lisenby's bill was a hostile takeover. She rewrote our conversion therapy bill, and really provided cover for conversion therapists to continue their harmful practices. We won't allow it to move forward.
By the time emotions cooled, it was too late.
So we're hopeful that Governor Herbert will call a special session and we'll be able to address this issue in interim.
This thing kind of erupted and blew up, and that's unfortunate. The effort was to find a common ground to make it better than what we have today as the status quo.
Governor Herbert sees the importance and wants to give it a go as soon as possible.
So we've got to regather people around the table and see what we can do to come together and find what is the proper policy and put that into legislation. If we can do that in a special session, that would be great. We don't call special sessions very often, but maybe it could be a part of the upcoming special session. But that means we've got to get people to agree. Again, the emphasis should be on suicide prevention and making sure that our LGBTQ youth understand that they're loved, they're cared for, they're respected. We love them the way they are.
We're hopeful. I know that people, one thing that we all have in common, whether you're members of a faith community or you're Republican or you're Democrat, whatever, we all want young people to be healthy and happy. And so I know that we can find common ground there.
What's next is for the governor to sign these bills, which I firmly believe he'll do enthusiastically.
Our goals would be to have 0 suicides in any age group, in any category of human existence. We want everybody to understand that they're worth, and we want them here, and we love them. And if I could pass a piece of legislation, that would be you have to love everybody, treat everybody nicely, and have mutual respect for difference of opinion, care about others, and deal with issues with civility. That's a piece of legislation I'd like to see passed and have us all adhere to.
We want to thank you for staying up with us. If you or someone you know is in crisis right now, help is available.
Call the hotline on your screen and have a great weekend.